So I am proud with the result. I have investigated all of the cut which is here. Though a lot of people scared to have the cut in front of the hairline, I reduced the width of her forehead to match with the golden proportion of beauty. I measure from here to here seriously and make both sides that used to be uneven to be the same on both sides, and I adjust her hairline to be feminine and not recessed back like an old woman. I try to save the cut, expose only the cut where it's really needed. And what we have seen is the wrinkles here that used to be a lot more gone, wrinkles here gone, the eyebrow that used to be lower get higher, and all the function of the muscle in the forehead perfect. I test it. She can move both sides, and her upper eyelid that used to look heavy 2 weeks ago, that make her eyelid crease not even. It looks not stretched and not right. Now it's turned to like she had already had the upper eyelid surgery, but she did not have it. It is automatically corrected by the forehead lift. Not only that, I try to find a way to tighten the side part of her face. Please turn to that side. I tighten this part by the hidden cut. You might not see the cut here. I cut through here, but there is no hair loss here at all because I use the stapler and preserve all the hair follicle. And then this cut is called temporal lift. Someone call it the foxy lift. It's I try to not make it so foxy by pulling it aside, and the upper eyelid I raise it a little bit, and I go far beyond all the temporal area to meet the mid cheek. I tighten the mid cheek, which is a lower eyelid area. Now her lower eyelid area is tightened. Now no matter how we try to pull it down, you will see that a lot of old women or old men, whenever we are getting older, the ligaments and the muscle turn weak, and it is very easy to have the ectropion, mean like this, the lower eyelid is not snappy to the eyeball. Now no matter how I try to move it down, it does not move. It means that completely locked to the place, and you will not get that happen. It is permanent. The cut need to be hidden along here. Now it is still red because we just removed the stitch. Please be patient. 4 months later, it look like nothing happened to you. And the neck, turn aside more. Turn to that side. She used to have the big groove here, and the jaw marionette line means her mouth droop and point down a lot. And continue with the lumps of the fat that is hanging here. I create the jawline by pulling the mass or the deep muscle layer and tuck it in the standard way like the Ben Tale and doctor who is very famous in Los Angeles tuck it in the mastoid crevice here. I do the complete neck lift and flex down. And you will see that I have tucked it and make the cut in the muscle and tighten her wrinkled neck. Now her neck is like a tight cylinder, but not real cylinder. It still be movable. It is still the skin. And her face, the wrinkles that make it look tarnished and have a micro wrinkle around. I know that it will save her from a lot of cosmetics. The bruising here around is proof that my cut here does not only make the change inside on the periphery, but it goes through the medial part. It goes everywhere on her face to change everything, and she smiled very even. I did the very dangerous job going through the deep muscle layer, deep plane technique, and I have passed through the nerve without injury.
Thank you ขอบคุณค่ะ